All right, welcome. Today, I'm thrilled to have Rex Wallace with us. He's the founder, CEO, and driving force behind RWC, a consultancy dedicated to evaluating healthcare through quality, operational excellence, and stakeholder engagement. So, Rex, your expertise is invaluable to those navigating the complex digital health landscape and from providers to even payers. Thanks for being here. I'm eager to hear your take on the payer ecosystem, the like all the pinpoint solutions, the challenges. Sorry, all the point solutions, the challenges, and how do we explore the opportunities? So we'll jump right in. So first off, can you describe the STARS rating program? Tell us a bit about how the system works. Some of the folks that are listening in have gotten involved, but they don't know the exact impact on the healthcare providers and vendors and payers.
Yeah. At the highest level, and yeah, Liz, thanks for having me. Excited to be on today. And the Star Ratings program, it's consider it sort of a universal scorecard for Medicare Advantage plans. CMS designed it. The main intent is to help Medicare beneficiaries who, I think the average beneficiary now has 40-ish health plan options, right, in their zip
Hmm.
code. So pretty overwhelming, and they all look kind of similar. And I think historically members or Medicare beneficiaries kind of look at the premium and the expected cost share, and they kind of base it all on cost, their decision, right? So NCMS wanted beneficiaries to have a way of selecting options based on something else like quality. So they created a quality scorecard. Medicare Advantage plans are all scored the same way. It's consistent, across the board. 40-ish measures every year that cut across, clinical effectiveness, like HEDIS measures. So, cancer screenings, what percentage of your members have had a breast cancer screening this year? What
Yeah.
percentage of your members manage their, are diabetic and have their A1C under control? But it spans across the other domains as well, pharmacy measures and operational efficiency measures, and um, really kind of a
And
whole
Rex,
holistic picture.
one of the things that always comes up is what's the most important now? Like with CAP scores and others, what are people focused on? Where are there innovator, I think, problems to solve? And how do we help support some of these startups to get that?
Yeah. And it might depend on who you ask a little bit.
Mm,
The caps. So measures have different weights, categories have different weights. So, and CMS changes those weights sometimes to increase focus on certain categories. So, like you mentioned, the CAPS measures, right? The CAPS survey is a member experience survey done with connected to a random sample of members. So, if you have 100,000 members in your Medicare health plan,
hmm.
only, let's say 400-ish will get and fill out the CAPS survey, and all of your CAPS measures are, which right now is about a third of your star rating, because those measures are very heavy weighted right now. So a third of your star rating is based on basically 400 responses to a random survey, asking them about their experience with their provider, with your plan, with the at the pharmacy
Hmm.
counter, etc. So in my experience, in my opinion, those are the most important measures, because they, not only because they're heavy weighted, but because they measure things that no other measures really get at, such as access to
That's
care.
right.
And
So
to me,
you look at the
that's the
intersection
biggest.
between what is more heavily weighted, what are where other measures are not weighted inside the sort of system, and then some of the new technologies. How do you think about that too, with AI and telemedicine being utilized? What are those opportunities where you feel like it's like almost like the Venn diagram of exciting new opportunities for structure, for innovation, and I think a huge demand and need, and then also serving better patient outcomes and ultimately having a great mission for it.
Yeah, to me, it all comes back to two things. You know, if you can increase access to care, through AI, through telemedicine. I mean, obviously, telemedicine does that. You know, a member cannot close a gap in care if they can't access care. They
Hmm.
can't refill their medications to better manage their diabetic, situation, if they can't access those drugs, because cost share's too high, or they're in a pharmacy desert, or there are prior auths in place, or a million different reasons. So anything you can do to increase access to care, and to build trust. So those are the two things that I always kind of go back to. If you can, the most important things you can do pretty much in stars and pretty much across the board, I think are, I think health plans are designed, they're in business to provide access to care. So if you can increase access to care through technology, and if you can build trust with members by understanding their preferences and communication and honoring those preferences and communication, and not bombarding them with other channels that are not of interest to them, I think that's where the key is.
Can you talk a bit about the challenges of honoring those and/or challenges of different startups and problems that they have to solve to make sure that they're as effective as possible?
Yeah, I mean, in my experience, we don't do a good job. Our industry, it's it's not news, right? That we're behind a lot of other industries. I mean, we work with a lot of our firm works with a lot of customer experience vendors who do work in the airline industry and the
Mm,
hospitality industry, and they're so far ahead of us. And they're
yes.
these vendors are trying to help bring us kind of up to the standard of some of those other industries, retail, obviously, like Amazon. um so in my opinion, we don't do a good job of connecting the dots. I think we build these, and you kind of started off with mentioning point solutions, right? So
Mhm.
we vendors have an idea, they create a solution, and and build a really compelling solution to do something that they think is important. But I think we fail to connect the dots effectively, to really understand what the depth of the pain point, the problem that we're trying to solve in health
Mhm.
plans. What is the problem? Do we really understand it deeply? um and are we pulling the thread all the way through? Are we really understanding the impact that we can have, not on a specific point, but on a broader issue for the health plan? Because that's when we get their interest.
That is really great. I think especially as you're pulling the thread and, having this, like, sort of end-to-end journey, and you can build out the technology and the information that you can share with the payer to support their needs. One of the things that also comes up often is based on your journey and achievements, what advice would you offer current and aspiring leaders in healthcare that are aiming to leverage technology or look for these opportunities to improve patient care or operational efficiency? Where do they start when they're looking at this? Can they pull down the HEDIS list? Can they look at stars ratings? Or do they look at populations? Because later on, we'll jump into some of the questions on if you go after employers or do you go after the commercial or do you go after Medicaid? But where do they start when they're trying to assess what this opportunity is, what the technology is, what the patient population is, and how do they address the needs?
Yeah, I think you need a couple of things, right? So you need there's a lot of public data that, if you know where to find it, it can tell you a lot about pain points within health plans, pain points as an industry, kind of where the biggest problems
Where would you
are
go? Could
at the
you
surface
list some
level.
of them?
Yeah, I mean, on on the CMS website, they have all the star ratings. That's our domain, right? So our primary domain. So there are lots of files on the CMS website where, and a lot of vendors work with people like us to understand that and access that as well. But
Hmm,
they are public, and there are, by parent organization, by contract, you can understand how how every health plan scored on every measure, and how they've scored historically on every measure, and how many members they have in their health plan, to know how big of a problem this is, and to estimate what is the revenue impact, for health plan A,
mhm.
who scored below 4 stars this year because of these two measures that declined. And if those two measures wouldn't have declined, they would have earned, roughly $50 PMPM in quality bonus payments for stars, right? So
Right.
understanding all of that public data, but then having some expertise or some experience to understand, to understand the big picture, and understand, again, kind of pulling that thread all the way through, right? The um, this measure performance, but also, what in the industry is going on, understanding the regulatory changes, understanding consolidations and what impact
Hmm.
that might have on the industry or on cut points. So I think having experts sort of at least phone a friend, right? Access to is really important, I think.
That's such a good point, and being able to get the right experts. Some people always ask too, how do you find experts? How do they find the right people, the advisors, and do they attend networking events? Do they try to attend conferences? What's the best way to find out who you need to meet to find let's say, a champion for you within a healthcare organization?
Yeah, I think two things come to mind. One, conferences. There are, and we're talking mainly star ratings right here. So from a Medicare star rating standpoint, there are a couple of very focused star ratings conferences throughout the year. One in June, a couple in June, and a couple in December. So put on by Rise and SSN, right? So
Hmm.
Koalapalooza, Star Ratings Masterclass, and then the SSN Stars and Quality conferences in June and December. So those four conferences can give you access to a lot of people, a lot of speakers who you'll understand are experts. And then LinkedIn, just follow hashtag star ratings, right? And you'll hear who's talking about it and see what they're saying. There's a lot of discussion on LinkedIn about stars, a lot of information sharing, a lot of very generous experts are sharing a lot of information on there. Whether it's regarding industry events, or industry happenings, like big things in the news. you know Yesterday, I think, you know Elevance won a big lawsuit, right? That it's
Yes,
getting lots of press.
that's right.
The change healthcare issue, lots of posts about the impact to stars, the impact to MA plans, the impact to
Hmm.
kind of the industry in general. So yeah, follow some hashtags on there. You don't have to follow certain people, or you obviously can, but you can follow hashtags and get a lot of the great information.
So this is a great point to kind of segue into, how do you think about then, as we as an organization, um, in anywhere that they want to kind of serve, pivot to commercial side, Medicare stars, rating side, Medicaid side, and then employer side. Do you carve those out in different ways? And for example, on the employer side, uh, how does one get started with employers? Do they look at TPAs? Do they leverage consultants? And how do they think about the employee wellness programs and consider EPAs and others?
Yeah, it's a good question. And I spent my first before I got into Medicare, I was actually an employee benefits consultant on the commercial side. So
Yes.
I know it's changed a lot. That's been quite a while ago, and but yeah, each one has its own nuance, right? So like our team, for example, we have um, we have seven experts, and we have a couple who have played in all spaces, so Medicare, Medicaid, marketplace, commercial, and they're all different, but there are definitely dots that connect them. So I think understanding the nuances between each, having some experts to lean on and ask those questions. I think to your question about um, TPAs versus consultants, right? Yeah, I mean, I think I know people that go both ways, right? So
Yes.
TPAs, um, the payers who serve, not just on the TPA side, but the health plans who have huge commercial blocks, who play a role in helping these commercial accounts. Um, but I think I would always, I'm a little biased maybe, but I would always, if I'm going into a new space, I would probably access a consultant, right? And like
Yes.
someone who has been there, who knows all the ins and outs, and who I can, structure an agreement with that's favorable to all parties, and can give me exactly what I need to understand what's going on in that market, and kind of how I can play a role, right?
Absolutely. I think it's interesting when I talk to different digital health companies, they want to structure it in a way that makes sense to them. But
Mhm.
sometimes their product, let's say, is smoking cessation, but there isn't as huge of a need, let's say, in a certain patient population or employee population as there is in a certain demographic or a certain type of industry, versus looking at whether or not it's a good Medicaid opportunity, and then versus a Medicare and how they structure, but also the language that they use in the marketing materials for employees and or employer benefits. It's oftentimes retention, productivity, total medical cost reduction, but within maybe a 3-year timeline, as opposed to if it's a commercial line of business, fully insured, it's sort of the 12-month ROI. And then if you're looking at, let's say, Medicare, sometimes it's a larger population, but Medicaid may be more focused on, let's say, pediatrics and or maternal health, mental health, and other areas. So structuring in a way that is more specifically focused on what you're what you're trying to ultimately achieve for the organization that's paying for it is going to be
Mhm.
key.
Yeah, and it's most of my experiences on the Medicare side in
Hmm.
commercial before, um, but I've been in lots of Medicaid meetings, with clients, and I remember some of the first Medicaid meetings I was in, coming from years in Medicare where I was focused on the elderly and disabled, right? And
Yes.
then all of a sudden I find myself in a brainstorming meeting trying to find ways to get, you know, new young moms to get into a well child visit, right? With
Mm.
their child.
Mm.
And it was accessing entirely different parts of my brain, right? And it was a really healthy exercise to go through. And also I think, I didn't know what couldn't be done. So which I think was somewhat advantageous at that point, right? Where I didn't have blinders on, or it wasn't conditioned to think, well, these new moms won't come in for this reason. Um, I think everything was on the table, and I think it's good to have some people in the room, maybe who they don't do this every day, right? To have sort of a fresh perspective sometimes when you're brainstorming, but definitely taking time to brainstorm and think and collaborate are big keys.
Absolutely. Another question that always comes up too for a lot of our guests is, uh, if you're thinking about serving as a compass for our listeners, guiding them through their business decisions, and with that said, when you're facing pivotal changes, how do you balance risk with possible benefits? And are there specific principles that you live by that guide you through the decision making process on which clients to pursue or where to target for your mission and for what you want to achieve?
Yeah, and we had someone on our podcast recently who we were talking about something, and she said, um, if it doesn't bring you joy, don't do it, right?
Mm,
And it's hard to always honor that in business because you have to pay bills.
yes.
But there's something to that, right? I
Absolutely.
mean, when I started this firm, it was, a little bit of it was wanting to control my own destiny, but a big
Mm,
part of it was wanting to build something, fun, and where it was, work with people I
yes.
like to work with clients I like to work with, and we do, right? So it's been so rewarding. So I would say, as much control as you have over that situation, make work interesting and fun. I think some of the things I probably live by are, you know don't um don't think anything is impossible, right? I think
Mm,
with the right people in the room, the right collaboration, taking time to really think through, what you're going to do, and
yes.
then just continuing to hone the messaging. I think, when we're working with new vendors, especially, what we find a lot of times is it's not the solution that has, that's lacking. It's just maybe the ability to articulate the impact it has, right? Or what it really does, or, again, kind of connecting all those dots. And I think taking the time to rethink and rethink and rethink how we're messaging this, and tightening it up every time. One of my
Mm,
favorite classes in college was a class where we started out with an 8-page paper, and then the very next project was, okay, say all of that in 4 pages, and
Ah,
then
yes.
the next project was say all
4
that in two
sentences.
pages, and then to 1 page, right? And it was one of the most valuable things I probably ever learned because, you know, people don't have time to read a lot. People, the how tight the messaging is and how accurate it is and how
Mm.
brief it is, go a long way towards getting buy-in and getting someone's attention.
I
Um,
find that true to be in our everyday life too, not just for who you are, but who the company you work for, what you stand for, and being able to, especially in conversations, engage someone pretty quickly and understand what are they looking for, what
right,
will make them look good, what are they aiming to get out of this like 20-minute meeting,
right,
and being able to hone in your message to say, this is what we're looking for from this partnership. Does it make sense? If it doesn't, can I put you in touch with someone that is helpful to you? And or are there things that we can do together? Should we table this for 6 months later? And just being very direct, especially as you said, with lack of attention spans and
right.
people sitting through meetings all day and being able to cut to the chase and having, like you said, instead of a 10-page, 4-page down to a couple, 1 page can be really useful.
Hmm. For sure.
Are you also working on other things right now? Anything exciting for you as you're thinking about your company and the industry and stars?
I mean, probably one of the biggest new things that we're working on is health equity, right? So
Mm,
it's not new, but it's newly important in the Medicare space. I feel like we're playing catch up with Medicaid, right? Where I feel like Medicaid has been on top of health equity to some degree for a long time. It's been an issue they've faced forever. Um, it's been an issue in Medicare, but it's just now becoming, critically important from a performance standpoint. So
yes,
CMS is changing a lot of the rules to say, we have to we have to, like in star ratings now, it's based on how effectively you reduce disparities in care. So,
right.
that's something really compelling, really meaningful that we are doing a lot of work in. We've got some resident experts who've designed, NCQA award winning health equity programs at national payers before that are on our team. So it's a lot of what we're doing right now is helping health plans understand their data, helping health plans develop strategies to reduce disparities in care for those members who have social risk factors. Right, they have transportation insecurities, housing insecurities, financial insecurities, etc., food insecurities.
That's great.
Um, so it's meaningful, but it's definitely new. Yeah,
It sounds very exciting, and it's so, important. I always talk about how if you don't have access to everyone, access affordability for everyone, I feel like we failed folks, and I think
yeah,
we need to really rethink what are we structuring for an equitable society, and especially with even at Everly Health, we think about sort of lab deserts and,
hmm
areas where we could really support home testing, um, and I will say at the end of this podcast, one of the things I always ask is, what personal habit or philosophy do you believe has been most instrumental in your success in this world? And what kind of advice can you give folks that you think? I really liked your first one about does it give you joy? So I'm hoping to hear some other great words of wisdom.
and I've probably kind of mentioned some of them already, but I would say, I mean, we're we're here for connection, right? So relationships are really important and drive everything. So I think it's we typically can't do great things alone, right? It takes collaboration to make things at least as great as they can potentially be. So I think focusing on relationships, especially,
Mm,
I think that's one of the things about star ratings that really resonates with me is the fact that it's a matrix program, right? The star ratings leader in a health plan doesn't really have control over any of the measures. I mean,
mhm,
they don't really have control over anything. It's all about influence, right? So can you influence the people around you? Can you connect with them and engage with them? And engagement's the word engaged, and that's why I like the work that Everly does, because to me, engagement is everything. Engagement is everything for stars, because
mhm,
if you're not engaging with your
absolutely.
members and your providers, but also your vendors, and most importantly, probably your, you know, internally your executives and your cross-functional partners. If you're not driving real engagement with all of these people and connecting with them on their level, then you're not going to succeed, right? It doesn't matter how tactical you are or how smart you are, um, how much you know about stars. If you can't engage in these people, you're not going to do it. So to me, yeah, understanding that, connecting with people, engaging with people, um, and then yeah, again, just pulling the thread all the way through, taking time
Yes.
alone to think and to strategize. And I love time on airplanes because it's kind of no distractions, and you know 2 or 3 hours of just thinking time, and I think we don't do that enough. And
That's true.
so taking time to think, focusing on collaboration, with people, connecting with people, and then pulling that thread all the way through, really thinking through the entire impact that your solution can have. What problem are you trying to solve? And then how, like being able to articulate that message, the impact of what your solution is doing.
That's great. Well, Rex, it's been an absolute pleasure. I really appreciated the discussion and especially looking at the healthcare landscape with you today. I know you have tons of insights, and I really appreciate all the information also on where to go on websites and where to go to look for information, but also the challenges in innovation. And thank you for sharing your knowledge and also the impactful work that you're doing at RWC. So, for listeners, for more on Rex's work or to connect directly, check him out on LinkedIn, and email are in the show notes. We hope today's conversation has your curiosity and inspired you to explore further. So, thanks for joining us. And until next time, keep on innovating.
Thanks.